Hello everyone, welcome to today's lesson with Alem. Today we're going to look at the nursing care plan for Cholera. So in our previous video, we have we have learned about how to write the nursing care plan. So here now we're going to learn about one of the nursing care plans for a condition known as Cholera. So we already know that Cholera is one of the infectious conditions that we have, and is caused by a bacteria known as Vibrio cholerae, of which the route of infection is the mode of transmission is orophycal route. So from there now we're going to go into the nursing care plan for our cholera, our condition which is cholera. So first we start with problem identification. So remember in our previous video, we mentioned to say the first thing that you have to do when writing a nursing care plan is to do assessment. So here on the screen, we do not have assessment, but we are going to talk about it. So assessment, the first thing that we assess are the signs and symptoms, of which we understand that number one, for cholera, we have profuse vomiting and diarrhea. So profuse vomiting and diarrhea will result in the patient being dehydrated because they are losing a lot of fluids. That means they are going to be dehydrated. And as a nursing problem, that will be termed as fluid volume deficit. So because of vomiting and dehydration, vomiting and diarrhea that we have seen under the signs and symptoms as we are assessing the patient, that will result in dehydration, which means the nursing problem is fluid volume deficit, meaning reduced fluid in the body. So therefore, our problem is fluid volume deficit. We move to the nursing diagnosis. As we can see, the nursing diagnosis is fluid volume deficit due to, or you can write related to, diarrhea and vomiting, evidenced by sunken eyes, loss of skin turgor, dry mucosa membrane, of which these are signs of dehydration. So remember we said the diagnosis starts with the problem. So the problem is fluid volume deficit. Related to or due to, those are the causes. So why do we have fluid volume deficit? It is because of excessive diarrhea and vomiting experienced in cholera. Then how do we see that this patient is having fluid volume deficit? We see it by the signs of dehydration. And these signs of dehydration are sunken eyes, loss of skin turgor, dry mucosa membrane. So that is our diagnosis. From there, we move to goal or objective for this problem. Our objective or goal is to restore patient's normal fluid volume, within 5 hours of admission. So this goal in itself is smart because it is being realistic that we are going to give as much fluid in 5 hours, and it has a time component. So remember, each goal has to be smart, specific, measurable, attainable, relatable, and time bound. Then from there, we have intervention for our problem. So the first one is I will cannulate the patient for intravenous access so that you cannulate the patient so that you can give IV fluids. Number two, I will administer normal saline for fluid replacement. So normal saline, as we know, is a blood expander. So you can say I will administer normal saline for fluid replacement. It will help in improving or increasing the fluid levels in the body. Remember, normal saline is an isotonic solution, meaning it can have or it has the same balance as blood. So when you administer normal saline, it is going to increase the fluid levels in the body. Number 3, I will assess the fluid and electrolyte status during each shift to monitor progress of hydration. So this one is just one of those points where you monitor fluid and the electrolyte status during each shift to monitor progress of hydration. Number 4, I will strictly monitor and record accurate intake and output on the fluid balanced chart to avoid fluid overload. So we are going to make sure that the fluid that we are giving to the patient and all that fluid that they are removing, which can be through vomiting or diarrhea, is recorded on the fluid balanced chart to avoid fluid overload, even underload. Then the other point that we can also include here is I will administer Ringer's lactate to replace lost fluids and electrolytes. So as we know, Ringer's lactate is one of the fluids that has a load of electrolytes. So because this patient is vomiting, okay, because this patient is vomiting, we can give Ringer's lactate. Because of vomiting and diarrhea, they are losing a lot of electrolytes. So we give Ringer's lactate to replace those electrolytes. So those are some of the points that we can put on our intervention. Then from there, we have evaluation. Under evaluation, remember, here you are just summarizing. It's a summary at the end to indicate that you have achieved your goal. So evaluation, patient's normal fluid volume restored within 5 hours of admission, evidenced by good and normal skin tag with moist mucosa membrane. So that is how we are going to evaluate. So remember, evaluation should have evidenced by. So that is our very first problem that we have under Cholera. So we have other problems. We are going to explain them, but for now, let's stick with these ones. The second one. So the second thing that we have to understand is that when the person is excessively vomiting and passing diarrhea, they are going to lose a lot of nutrients and they are going to need a lot of nutrients to be involved in the metabolic rate. Not only that, they are also losing a lot of nutrients because these nutrients are not properly absorbed in the gastrointestinal tract. Therefore, there will be reduced nutrients in the body. So because there is reduced nutritional or nutrients in the body, that problem we can say that is altered nutritional status. So remember, because of diarrhea and vomiting, this patient is losing a lot of nutrients. Therefore, that means that they have altered nutritional status, less than body requirements. And remember, in Cholera, there is also weight loss. So weight loss signifies that this patient is having a lot, or this patient is losing a lot of nutrients. So they can lose it through vomiting and diarrhea, and they can also lose these nutrients through increased metabolic rate or reactions. So therefore, our problem is altered nutritional status, less than body requirements. So our nursing diagnosis will be altered nutritional status, less than body requirements, related to or due to excessive or excess vomiting and diarrhea, evidenced by weight loss or loss of weight. Then we move to our goal. Our goal will be patient will have a normal nutritional status throughout hospitalization. So what we want to do is to maintain a good or normal nutritional status throughout hospitalization. Then from there, we look at our interventions. So our interventions read, I will give parenteral feeding in order to provide necessary nutrients lost through vomiting and diarrhea. So as we know, parenteral feeding, this is the type of feeding that is other than oral. So other routes of administration other than oral. So we are going to make sure that we give this patient nutrients through parenteral feeding. Number 2, I will promote oral care every after the patient has vomited to refreshen the mouth and promote salivation, thereby enhancing appetite. So remember, when this patient is excessively vomiting, they will not be able to eat and their mouth will be bitter. Therefore, when you perform or assist the patient to perform oral care, the patient will have at least a good taste in their mouth, and that will help them or encourage them to eat because now they have a good taste in their mouth. Then from there, we also have another point, which is I will provide a mixed diet that will provide all necessary nutrients once vomiting stops to promote a good nutritional status. So this one is another point where you say I will provide a mixed diet or a balanced diet. So a balanced diet is a better term, but mixed diet is also okay, so that it can help the patient to have all the nutrients that they have lost once the vomiting stops. So another point is I will provide small frequent feeds to promote appetite once condition improves. So once this patient reduces in terms of vomiting, you now have to start giving small frequent feeds. So small portions of food in a more frequent manner, more often, so that the appetite can improve. Then we also have another point where you can say, I will encourage the patient to take fruits to provide vitamins which will improve the nutritional status of the patient. So this is another point where you just say, I will provide the patient with foods rich in vitamins to improve the nutritional status. Or you can put another point, which is I will provide the patient with foods rich in carbohydrates such as sugar to or for energy. So those are just points that we can include. But remember, be cautious and considerate that this is a cholera patient. Therefore, whatever you are doing, know that in the first few hours, this patient is excessively vomiting and passing diarrhea. So the best route, the first intervention should be giving parenteral feeding. That should be the first point. Or you can also put a point which says, I will assess the nutritional status of the patient to determine the interventions to be given. So that is another point that you can put. From there, we move to evaluation. So evaluation will say patient's nutritional status restored. Patient's normal nutritional status restored throughout hospitalization, evidenced by weight gain. So when the nutritional status of the patient has improved, the weight of the patient will also improve or increase. So that is our other point. Any questions so far? If you have any questions, you can just ask in the comment section. So that is our evaluation to say patient's normal nutritional status restored throughout hospitalization evidenced by weight gain. So don't forget, evidenced by evaluation has evidenced by. Then from there we go to anxiety. I'm just trying to find very simple problems that we can put into the nursing care plan. And if you've noticed, these problems are according to priority. From there we have anxiety. So anxiety will be there. So remember, when we're doing our assessment, the first thing we do our assessment, find that this patient will be anxious. Why? Because they are having profuse diarrhea, because they are vomiting, because they are now weak, because they are now being told that they are going to be taken to an isolation center. So just imagine this patient who was okay few hours ago starts to vomit and pass diarrhea. Then from there, they are now at an isolation center. For example, here in Zambia, we used to take our patients at the Heroes Stadium there. So the patient will be anxious. Why am I here? So that is on assessment. So from there, our problem is anxiety. So from anxiety, now we move to our nursing diagnosis. So anxiety related to uncertainty of the outcome of the patient of the disease, evidenced by patient asking a lot of questions. So this anxiety can be related, number one, due to the uncertainty of the outcome of the condition. Number two, it can also be anxiety related to the fear of death, because people die from conditions such as cholera. So, but the fact is, the patient is anxious because of the disease itself or the symptoms that the disease manifests with. From there, we move to goal. So, our goal is to allay anxiety throughout hospitalization, to allay anxiety throughout hospitalization. So this one is SMART. Anxiety cannot be allayed in one day or in a few hours. Same with knowledge deficit. It takes time for people to stop being anxious. So that is that. So remember, the goal has to be SMART. From there, we move to our interventions. So our interventions are, I will explain to the patient the reason for putting them in isolation to allay anxiety. So the first point is that when this patient comes into your ward, you have to put them in isolation because they're a cholera patient. So you have to explain to say the reason why we have put you in isolation is because you are infectious. You can infect or cause sickness. You can infect other people with cholera. Then from there, I will allow the patients to ask questions and answer the questions accordingly to increase knowledge about the condition and allay patients' anxiety. So you have to allow the patient to ask questions and answer them accordingly to increase the knowledge and allay anxiety. From there, the other point is I will explain the disease process to the patient to increase the patient's knowledge about the condition. So I will explain. So you have to explain the disease process, how they get infected, how they are going to how they can infect others, the treatments involved, and all that you have to explain so that the patient will have enough knowledge. Because we say knowledge is power. So when they have enough knowledge, they will be less, or they will be reduced anxiety, because they have at least the knowledge required about that specific condition. From there, our last point is I will explain all the nursing procedures to be done on the patient to gain his cooperation and prevent unnecessary anxiety. So you have to explain each and every procedure that are to be done, or that you are doing on the patient, to prevent unnecessary anxiety. Then lastly, the interventions. Anxiety was allayed throughout hospitalization, evidenced by patient verbalizing and cooperating in his or her care. So that is the way we can write it, and as you can see, it is very simple and doable. So from there, we move to now the risks. So we have 3 actual problems, and then we are going to go look at 2 potential problems. So when we are assessing, number 1, we have to understand that our patient is sleeping on the bed. So there are specific beds that we call Cholera beds that have a hole on the buttocks of the patient, so that they can allow them to pass diarrhea. And mostly what happens is these beds will be wet, because this patient is vomiting and passing diarrhea. The patient will be in stool, and the bed will be wet. So you find that there will be a lot of wet linen, and the patient is sleeping there. So what will happen if the patient is sleeping consistently on a wet surface? The skin will break. So here we can say risk for pressure sore formation, or risk for impaired skin integrity. So it can go either way. It's either risk for pressure sore formation, because the sores will form on the pressure areas, but it can also be risk for impaired skin integrity, because this patient is sleeping on a wet surface and the skin will start to break, or it can even form rashes, irritations, and all that. So that is our assessment. So here we've chosen our problem to be risk for pressure sore formation, but I've also said we can put a problem such as risk for impaired skin integrity. Then we go to our diagnosis. Our nursing diagnosis is risk for pressure sore formation related to sleeping on soiled linen and being bedridden. So the reason why this patient will have or may have pressure sores is because they are sleeping on a wet soiled linen, and they are bedridden in that specific time. Imagine you are sleeping on a wet linen for 3 days. You will develop pressure sores, or the skin will develop some irritation. And remember, we said for potential problems, you only have the problem itself and the related to. Remember, related to is the cause of your problem. Then from there, we go to the goals. So the goal is patient will have an intact skin throughout hospitalization. Patient will have an intact skin throughout hospitalization. From there, we move to our interventions. Our interventions, number 1, I will change the patient's position to hourly to prevent exerting pressure on the indominus area, thereby preventing pressure sore formation. So basically, this point is just saying I will change the patient's position to hourly to prevent pressure sore formation, or to exit to prevent exertion of pressure on the area of the skin. That's what we are just saying there. So the first point is I will change the patient's position to hourly to prevent pressure sore formation. The second one is I will change sewed linen often to prevent moisture, thereby preventing skin breakdown. So remember, we're saying sewed linen. This sewed linen is usually wet. So when the patient is sleeping on wet linen, it means that the skin will break down. So you have to change that linen. Then from there, I will perform pressure area care daily to prevent pressure sore formation. So you have to do pressure area care. And then lastly, I will assess the skin of the patient to determine the risk of pressure sore formation. So you have to assess the patient's skin on a daily basis. So remember this problem, we said we can also put it as risk for impaired skin integrity. Then lastly, we look at our evaluation, of which we're saying patient has an intact skin throughout hospitalization, evidenced by absence of pressure sores. So that is how we can put this one. So let's look at our last problem. So again, we go back to assessment. We go back to assessment, of which we're saying this patient with cholera is highly infectious. So if this patient is highly infectious, what will be our problem? Our problem will be risk for spread of infection. Risk for spread of infection, because this patient can spread the infection to other people. Therefore, we say risk for spread of infection. That's our problem. The nursing diagnosis is risk for spread of infection related to the infectious nature of Vibrio cholerae. So related to the infectious nature of Vibrio cholerae. So you can just say risk for infection, risk for spread of infection related to the infectious nature of the bacteria or the condition, or you can mention the actual causative organism. It's okay. From there, we move to the goal. The goal is to prevent the spread of infection to other people throughout hospitalization. So you want to prevent the spread of the cholera infection to other people throughout hospitalization. So here we have quite a number of interventions, but you just pick 4. So number 1, I will isolate the patient to prevent the spread of infection. So remember, all infectious conditions, you have to isolate patient. Number 2, I will nurse the patient using barrier nursing to prevent spread of infections. So what we mean by barrier nursing is where the nurse protects themselves from acquiring an infection, that infectious condition. So barrier nursing is where you employ putting on personal protective equipment, PPE. So it's either you say, I will nurse the patient using barrier nursing to prevent the spread of infection, or you can say, I will ensure that I put on personal protective equipment to prevent acquiring the infection. Then from there, you can, the other point is I will disinfect, decontaminate all utensils used by the patient to prevent the spread of infection. So any utensils that the patient has used, there is need for you to decontaminate them so that the infection will not be spread to other people. The other point is I will restrict visiting the patient to only authorized staff to prevent the spread of infection. So remember, only the authorized staff are authorized to will be allowed to go and visit the patient. By authorized, we mean only those only those medical staff. So the isolation center has specific people that are assigned to be there, and those are the only ones who have to be allowed to enter. Other point is I will ensure that the stool is disinfected before disposal to prevent the spread of infection. So remember, the stool is infectious. So before it is thrown away or disposed of, you have to ensure that that stool is disinfected. You might not be the one disinfecting it, but you have to ensure that before disposal, it is disinfected. Then lastly, I will ensure that the linen used by the patient is disinfected and labeled infectious before sending it to the laundry to prevent mixing it with other linen and therefore prevent the spread of infection. So number one, you have to ensure that before that linen is taken to laundry, it is disinfected. Then the other thing is that you have to ensure that it is labeled infectious. Then sent to the laundry to prevent the spread of infections. Then lastly, we have evaluation, of which was saying spread of infection has been prevented throughout hospitalization, evidenced by no new cholera cases from patients, from people in contact with the patient. So here our evaluation is that there is no spread of infection. Spread of infection has been prevented throughout hospitalization, evidenced by no cholera cases from the people in contact with the patient. So these are some of the problems that we can come up with. But of course, there are other problems that we can also include, such as other problems for cholera, such as number one, we have muscle cramps, which can be categorized as pain, but we have muscle cramps. We can also put another one, which is can also put another one, which is has to do with fatigue, which has to do with fatigue, meaning there will be reduced activities, which is activity intolerance. So there will be reduced tolerance to activity. This patient will not be able to do as much activities as they would want because of the condition. We have come to the end of our lesson. So for those who have not subscribed, can subscribe, and those who have questions, please ask your questions in the comment section so that we can respond to them. Thank you. Hope you enjoy the video. God bless.